Next one is an overview of eicosanoid metabolism. And the eicosanoids are very important components in the biochemical pathways, and especially the pain receptor and also the pain controlling and inflammatory responses. Everything controlled by eicosanoid metabolism. And you can see here this overall view of metabolism and prostaglandin biosynthesis. So the main precursor of prostaglandin biosynthesis is arachidonic acid. So C20 fatty acid, arachidonic acid, is a precursor of leukotrienes and prostaglandins and thromboxanes. And this overall view, just you can have a look. Arachidonic acid is a fatty acid, is a precursor for the synthesis of leukotrienes, and the segment of eicosanoids, and another segment is the prostaglandins and thromboxanes. So the prostaglandins and thromboxanes, and further, this is synthesizing a substance, that is called as PGG2. There is a prostaglandin G2, and the prostaglandin G2 that will produce prostaglandin H2. So from the prostaglandin H2, prostaglandin I2 and F2 will be produced, and at the same time E2 is also, and thromboxane A2 is also formed. So thromboxane is a category of the substance arrived from the arachidonic acid substance. Next category of the component is the leukotrienes. The leukotrienes are by the action of 5-lipoxygenase. That will be forming HPETE to leukotriene A4 and leukotriene LT-B4, because leukotriene means LT, and B4, C4, D4 and E4. So there are 5 different types A4, and from A4 the B4, C4, D4 and E4 will be formed. So this is the outline of the overall prostaglandin biosynthesis and leukotrienes, prostaglandins and thromboxanes. You can see here this cyclooxygenase 1, this enzyme involved in the formation of PGG2. At the same time, COX2, that is cyclooxygenase 2 is also involved. So the cyclooxygenase 1 is the very important, because this is the target site for majority of the anti-inflammatory substances. For example, the aspirin. Aspirin is a painkiller, and indomethacin and phenylbutazone, all the things are maybe the COX1 inhibitors. So this will inhibit the COX. Due to that, the prostaglandin synthesis and the thromboxane biosynthesis is controlled. Due to that, the pain is subsided and anti-inflammatory responses are induced within the body. The inflammatory signals are suppressed. And cyclooxygenase 2 is also another enzyme. This enzyme is also, this is a constitutive enzyme and this is a non-constitutive enzyme, and this enzyme is induced by cytokine and endotoxin, growth factors and tumor promoters. These are all the factors inducing this enzyme activity. At the same time, selective COX2 inhibitors, that is COX2 inhibitors are the third generation type of inhibitors, and celecoxib, that is a very famous the painkiller, and the celecoxib, that is a painkiller and also anti-inflammatory substance that will selectively inhibits COX2. So if it is inhibits, means the PGG2 synthesis is restricted. So due to that, the inflammatory responses are suppressed. So this is the overall view of prostaglandin biosynthesis and also the leukotriene. So this is the biochemical pathway leading to the synthesis of prostaglandins. Just you can have a look at the phospholipid containing arachidonic acid, that is C20. So this will liberate lysophospholipid, that is by the action of phospholipase A2. So eicosanoids are a family of very potent biological signaling molecules, which includes prostaglandins, thromboxanes and leukotrienes. All the three comes under eicosanoids. And in response, hormonal or other stimuli, phospholipase A2 induces the release of arachidonic acid from the membrane. So this is not an easy one, not available always. The phospholipase A2 is produced only by the action of the hormone or other inflammatory stimuli. That means the phospholipase A2 induces the release of arachidonic acid from the membrane, and this arachidonic acid converts into PGH2 by cyclooxygenase. So just now we had this prostaglandins just formed by the action of cyclooxygenase. So this is arachidonic acid C20, having 4 double bonds. We already explained, okay, this how to identify the delta, delta 5, delta 8, delta 11, delta 14. That means between 5 and 6, 8 to 9, 11 to 12, and 14 to 15 are the double bonds. Okay, that is represented here. The total carbon is 20, and only 4 double bonds are there. 1, 2, 3, 4. 4 double bonds are there. Okay, this is called as arachidonic acid, and just have a look. Okay, this is COO, arachidonic acid, that is arachidonate. And by the action of cyclooxygenase activity of Cox, and 2 oxygen molecules are required here, and this enzyme is inhibited aspirin, ibuprofen, okay, all the anti-inflammatory drugs, and due to that, okay, this Cox activity, the enzyme activity, and PGG2 is formed. Okay, this is PGG2 because, so this is 2 oxygen molecules are going to be attached, okay, with the ring, okay, this one and here. So this is going to be modified, the arachidonic acid is going to be modified, okay, to PGG2, and this PGG2 is going to be attached with, okay, one OH molecule also. Okay, this by the peroxidase activity of Cox, and this will be converted into OOH into OH. Okay, and this is called as PGH2. PGG2 is converted to PGH2, and this PGH2 again, okay, this is by the activity of peroxidase activity of Cox. The cyclooxygenase activity of Cox, at the same time, okay, peroxidase activity of Cox. There are 2 activities. One is cyclooxygenase. Cyclooxygenase means, okay, oxygen is required, and that will form a cyclic ring of oxygen containing. And the second one is the peroxidase, removal of oxygen, okay, from the one of the substance. Okay, that is called as peroxidase activity. And due to that, PGH2 will be formed. From PGH2, all the thromboxanes and other prostaglandins will be synthesized. The COX-1 is responsible for the synthesis of PGH, so that regulate the secretion of gastric mucin. Mucin is gastric mucinous. So the gastric mucin is very, very important to overcome the acidity of its own the gastric secretion. And COX-2 for PGH, okay, that mediate inflammation, pain, and fever. Okay, that is why this COX-1, if you are taking the brufen or aspirin, okay, that may form less secretion of mucin, okay, due to that ulceration, okay, will be formed. That is why, okay, most of the doctors, they will say that, okay, you have to take some omeprazole, some like substances, okay, this antacid substances along with aspirin or brufen, okay, to maybe the effects of less concentration of mucin, okay, that may be overcome. So this is not recommended, but no way, because we have to use that one, okay, for the painkiller or maybe the anti-inflammatory and anti blood clotting activity also. This is aspirin is a very, very important one, and now this is very famous, is a life-saving drug. Brufen is a painkiller, and COX-2 for PGH, okay, that mediate inflammation, pain, and fever. So that is why COX-2 inhibitors are very famous, and that will inhibit very specifically to COX-2, and that may also relieve the pain. Thus the pain can be relieved by inhibiting COX-2 enzyme. This COX-2 enzyme is going to be inhibited by some of the substances like this is COX-1 inhibitor. You can see here, this is aspirin and this is COX. So the cyclooxygenase, okay, having the serine moiety containing OH functional moiety. This acetylation of the OH moiety is this is inactivation of COX. Okay, the salicylate will be formed, and so similarly brufen. So this also form. This will also inhibit this one, the COX, and naproxen. The thromboxane induce the constriction of blood vessels and platelet aggregation. Low doses of aspirin reduce the probability of heat attack and strokes by reducing the thromboxane production. So thromboxane is very, very important. That will constrict the blood vessels and platelet aggregation. That means blood clotting is favored. So this thromboxane, the production is inhibited by aspirin also. So one thing is painkiller response, the non-steroidal maybe anti-inflammatory drug, NSAID. At the same time, okay, this will stop, okay, further blood clotting, that is the platelet aggregation, this aspirin. That is why aspirin is very important, okay, for as a life-saving drug. So just you can see here rofecoxib and valdecoxib and celecoxib. Okay, these are the 3 different types of COX-2 inhibitors, very strong and non-steroidal anti-inflammatory drugs, and this is having the side effect also, but if it is needed, okay, we have to use this one. And the linear pathway of arachidonic to leukotriene, we already completed prostaglandin biosynthesis. Now after that, okay, we have to go for leukotriene synthesis also. So this is the 20 carbon atom arachidonic acid, okay, as discussed, okay, previously. Now the leukotrienes, leuko means, okay, within the leukocytes, okay, that means the leukotrienes are the substances produced within leukocytes, okay, that means to control the vasodilation, vasoconstriction, and the platelet aggregation and everything. So the lot of properties are there. We can see the properties later, and we can focus only the biochemical pathway involved in the synthesis of leukotrienes. So there are two different branched pathways. So one is lipoxygenase. Okay, this lipoxygenase utilizes oxygen. Here also the same lipoxygenase involved in the oxygen, but the substance will be formed different. Okay, that means 12 hydroperoxy, the Eicosanoid trinoate. Okay, that means this is HPETE will be formed here. So okay, within the 12 carbon, okay, the OOH will be formed, and here in the 5th carbon, the OH will be formed. That is the only difference. Okay, the placing of OH moiety. So here it is 12th carbon, and here is 5th carbon. So that is why two different molecules will be formed. By multi-step process, other leukotriene will be formed, and specifically, okay, from 5-HPETE, the multi-step process, that will form LTA4 and LTC4, LTD4. That means leukotriene A4, leukotriene C4, and leukotriene D4. All the three are formed. Okay, this is the synthesis of leukotrienes, and so you can see the remaining properties of leukotrienes, thromboxanes, and prostaglandins. So this is arachidonic acid. The corticosteroids will inhibit the synthesis of arachidonic acid. This is a very, very important system. Okay, the corticosteroids, especially the cortisol, inhibits liberation of arachidonic acid. And arachidonic acid is the primary substance involved in the synthesis of 5-HPETE, that is for leukotriene synthesis, and cyclooxygenase 1 and cyclooxygenase 2 action. So that will be forming the further two substances, that is PGG2. So from PGG2, okay, that will be forming PGH2, and PGH2 is forming thromboxane A2 and prostaglandin I2, prostaglandin E2, prostaglandin F2A or F2 alpha. Okay, that may be named as F2A or F2 alpha also. And coming to the leukotriene A4 will be formed okay, by the action of glutathione, by attaching, okay, this glutamic acid, cysteine, and glycine moieties, okay, to this LTA4. So the LTC4 will be formed, and LTC4, LTD4, and LTE4 will be formed, and finally LTB4 is also one of the component. So totally LTB4, LTE4, LTD4, and LTC4, and the precursor is LTA4. Usually this LTA4 is produced in leukocytes, platelets, and mast cells, and heart and lung vascular tissues. Okay, this is prominently produced in these parts of the body. And next one is all the three, LTC4, D4, and E4, involved in the contraction of the smooth muscles, not only in the contraction of smooth muscle cells of the heart, and that is also involved in the spine also. The bronchoconstriction and vasoconstriction and increased vascular permeability, and cysteinyl LTs leukotrienes make up a slow reacting substance of anaphylaxis and involved in the pathophysiology of asthma. So the leukotriene is very important because due to the leukotriene and all the vasoconstriction of the small muscles and bronchoconstriction and the smooth muscle contraction, all the constriction may be possible, and due to that a lot of complication will arises. Okay, that is especially asthma. And next one is LTB4, that is a leukotriene B4 is there. Increased chemotaxis of the polymorphonuclear leukocytes and release of lysosomal enzymes and adhesion of white blood cells. So that will be there, okay, with leukotriene B4. So in the category of leukotrienes, there are 1, 2, 3, 4, 5 different types, and major types are, okay, these two. Next, coming to the prostaglandins, from PGH2, prostaglandin H2, okay, the H2 is synthesized from PGH2 by peroxidase and glutathione action, and the first substance is thromboxane. Thromboxane is another substance produced by Coxone family in the platelets, and promotes platelet aggregation, so that is mainly clotting factor, and constriction of blood vessels, and reduces the size of the arteries, and mobilizes intracellular calcium level, and constriction of the small muscle, smooth muscles and relaxation of smooth muscles. Okay, maybe the major function of thromboxanes. And so this is inhibited by mainly this the enzyme. Okay, this is inhibited by aspirin and also the ibuprofen. Okay, like COX-1 inhibitors are very famous, okay, to control this one. So that will reduce the possibility of platelet aggregation, that is blood clotting, and also vasoconstriction is maybe controlled. Vasodilation is enhanced, okay, by the inhibitors of that is COX-1 family. And the constriction of smooth muscle, especially the constriction of smooth muscle in the spine, okay, this is creating a lot of complication. There is the back pain, and so due to the neck pain, okay, may be formed. That is that will create, okay, further complications also. Okay, and this may be reduced by COX-1 inhibitors. And you can see here a lot of contradiction here. That is the same, the origin is same, but the two different products are formed, thromboxane A2 and the first prostaglandin I2 is there, the prostacyclin. Okay, another name is prostacyclin. You can see the contradiction, that is here the vasoconstriction is there, and this will do the vasodilation. And you can see the platelet aggregation will be there, and maybe it inhibits platelet aggregation. These are the two controversy. Okay, that means contradictory functions of thromboxane and PGI2, the prostacyclin. And next product is PGE2, that is prostaglandin E2, produced by most tissues of the body, especially the kidney. And vasodilation is the major property and relaxes the smooth muscle, and used to induce the labor and stimulates the uterine contractions and required for fever response. That means the prostaglandin E2 is and required for the fever response. That means due to this only the temperature is increased. This will go and bind to the hypothalamus and induces the that is heat formation or heat formation. Okay, that is why the fever is produced. So this prostaglandin E2 is synthesized, okay, due to the effect of any infection. For example, any infection that may lead to the synthesis of arachidonic acid, that signal, okay, may lead to PGH2 formation. The PGH2 may form, okay, PGE2 also. PGE2 is a signal that will go and target hypothalamus, and hypothalamus maybe induces the more body, maybe the temperature increase. Okay, that is called as fever, because the main purpose of fever to reduce the multiplication of bacteria, and due to the increase of temperature, the bacterial multiplication can be decreased. So that is a self-defense mechanism. That is why the PGE2 is involved here. So next product is the PGF2A or F2 alpha. They're produced by the most cells of the body, and the vasoconstriction. Here this is dilation, and this is constriction and contraction of the smooth muscles, and stimulates the uterine contraction and used to induce the labor. So both can be used to induce the labor, and this may be in the later stages, in the starting stages. Okay. And with this, maybe we covered all the areas of the prostaglandin and leukotrienes and thromboxane, that is eicosanoid metabolism. So this is completely overview is covered, and this is also very important for the examination. All the very best.